Let's understand what is a growth scan. Now, growth scan is a scan which is done generally around 30 to 32 weeks of pregnancy, and the second one is done around, say, 36 weeks. So, as the name suggests, we are trying to assess the growth of the fetus. And how are we going to assess it? We assess the growth by estimating the fetal weight. So we take measurements of the parameters like head circumference, abdominal circumference, the femur length, and that goes into a formula, into an auto calculation, and then we get an estimation of the fetal weight at that point. So that gives us an assessment, and we put it or plot it across a graph. Now, if it is on the 50th centile, then it is normal. If it is on the higher centile, like say 90 centile or 95th centile, then the growth is accelerated. That is, the fetus is gaining extra weight. And if the weight is on the lower side, like 5th centile, 10th centile, then that is alarming because it suggests that there is a growth problem. That is, the fetus is not putting on the weight as per expected normalcy. So this then categorizes the fetus into fetal growth restriction. Now, these fetuses will need extra care, extra monitoring by ultrasound, maybe weekly or 2 weekly, and that will also need additional Doppler evaluation and monitoring. So this is the importance of growth scan. Apart from estimating the fetal weight, we also check the amniotic fluid, the fluid which is there around the baby. The level of that is measured in the way of amniotic fluid index. Now we put this index also on a graph. If it is normal, it's good. If it is more, then that suggests a few things, and then we have to further investigate. If the amniotic fluid is less, then that is also not a very good sign, and then we have to take some measures to provide nutrition to increase the amniotic fluid. Apart from the fetal weight and the Doppler, we also check the growth and the amniotic fluid. We also check the Dopplers. Now, Doppler is checking the blood flow which is going to the fetus. It is checked in the arteries, the umbilical artery, in the middle cerebral artery. Now, these arteries will give us assessment of the nutrition which is going to the baby. If it is not going enough, then it will show us resistance to forward flow in these Dopplers. So that kind of is an alarming sign. Uterine Doppler is something which we check all through the pregnancy, right from NT scan to anomali scan, which gives us a prediction to development of preeclampsia in the pregnancy. So growth scan in total is basically assessing how our fetus is growing inside the uterus. Is it growing fine, or is it having a growth lag, or is it growing faster? So that's the importance of a growth scan.